Hi everyone, I am Dr. Cheryl Carthouse. I'm a naturopathic doctor. It's been a little while since I've done an essential oil video, so I thought I'd share this information with you. I had an inquiry today about juniper essential oil and whether it would help with mood or anxiety, so I looked into the research. And there's a couple studies that I'm going to talk about today. One of them looked at a human study, and the other one was actually an animal study that gives us a little bit of insight as to how this might actually be effective. So the first one, it was a human study, looked at juniper. It showed that a traditional use is usually for rheumatic arthritis, so it can help with the pain of joints, especially with that type of autoimmune condition. And the study actually looked at its power for an anti-anxiolytic. So that's like if you have anxiety, how we can actually use juniper to help change the mood and help change how the nervous system is responding. So the measures they used are to look into heart rate variability as well as blood pressure, which then gives us a reflection of which of the nervous system components, whether it be the sympathetic or the parasympathetic. So the sympathetic is kind of that fight or flight response. The parasympathetic is that rest and digest response. Which one of those might be changed when we actually just sit and smell and enjoy the juniper essential oil? So what they found was with 8 participants, which is a fairly low number for a study, so not a huge power, but to see if there's actually some significance and might warrant a bigger trial, they found that blood pressure actually decreased both the systolic and the diastolic by about 10 points in the group that actually smelled the juniper for just 10 minutes. They had it diffusing in a room. And they also found that the heart rate variability frequencies changed where it looked like it favored an increase in parasympathetic. So that's the rest and digest and the calming side of the nervous system was increased. So if there is some anxiety, some high blood pressure, this might be a really great oil to use. Now, how is this actually effective? There's a whole number of different constituents in juniper oil, as there is in most essential oils, and it's not just one thing like we might find in a more refined pharmaceutical or something where it's pulling out one type of constituent. So in the oils, that's the benefit, and one of the things I love about using plants is that there are a multitude of things that might do several different ones. But if we're looking to find what might actually be most effective to help this type of nervous system reflection, we want to maybe know which component it is, and we can actually increase that in some cases if we want to within the ratios that are within the oil. So this other study was actually an animal study, unfortunately. These things are still tested on animals, and it found that Cedrol, Cedrol, is one of the main components that increases the anxiolytic components of the oils. So they found that it actually probably works on the 5-HT system and with dopamine. So 5-HT is one of the things that can help us sort of feel a little bit calmer, and that whole system was upregulated slightly, and dopamine was actually decreased. So we might just want to keep this in mind that if someone, say, has Parkinson's, where we want to make sure that the dopamine levels are actually increased, that juniper might not necessarily be our first go-to if we're trying to use an oil for some of those anxiolytic properties. Something like bergamot, citrus, lavender, those types of ones might be best suited for that type of person. So I love the science behind this, that we can actually dig in and really understand what components are useful, because it helps to really target and get that perfect picture of who this oil might be good for. So check it out. I'll post the article links below. Let me know if you have any questions.